Good morning, Darlene.
Good morning.
How are you?
Good, how are you? How was your night last
Oh
night?
goodness, we got a lot of admissions going on,
Okay.
so we got so busy last night. But good news, we got a lot of discharges for today.
Okay.
One of them is my patient. I'm going to endorse her to you.
Okay.
Her name is Betty Rebel. She's in room B41, bed 2. Patient is an 80-year-old female. She's admitted 3 weeks ago for a fractured hip and with right total hip replacement. She has a new onset of atrial fibrillation upon admission.
Okay.
And she has no known allergies for anything. Patient has her usual medication for hypertension, but the doctor started her with a Coumadin. So the INR has been doing well. It's within a normal therapeutic level within the last week. That's why the doctor decided to discharge her.
Okay.
Patient is on a heart-healthy diet. Physio is in each day, and patient is up with minimal assistance with a walker.
Okay.
Patient lives with a daughter. She will be discharged in 1 to 2 days. I think the daughter and the patient has a few questions regarding with the Coumadin therapy.
Okay.
So maybe just give them some health teachings about it.
Okay.
So I think that's it for my patient.
Okay.
So yeah.
Once I'm done going through my patients this morning, I'll pop in and see what their questions are.
Thank you so much. Yeah.
Okay, you have a good sleep.
Thank you, and you have a good day.
Thank you.
Thank you.
All right.
See ya.
See ya. Hi, good morning. We are here to tell you about the key points about warfarin and the nursing considerations around warfarin and giving warfarin. The generic name is warfarin, and the brand name is Coumadin, warfarin, and Jantoven. Its chemical class, coumarin derivative, and therapeutic class is an anticoagulant. Warfarin is considered a high alert medication causing significant harm when used in error. Its mechanism of action is that it interferes with hepatic synthesis of vitamin K dependent clotting factors 2, 7, 9, and 10. This interferes with the clotting cascade. The therapeutic effect of warfarin is prevention of thrombolytic events by preventing coagulation. Its pharmacokinetics is its absorption. It's well absorbed from the GI tract after oral admission, and it's only available orally. It crosses the placenta but does not enter breast milk. It is a protein binding medication. It's 99% protein binding. It's metabolized by the liver, and its half-life is 42 hours. Its onset is 36 to 72 hours. It peaks at 5 to 7 days at a constant dose, and its duration is 2 to 5 days after discontinuation. For adults, the average starting dose is 2 to 5 milligrams a day for 2 to 4 days, and then you adjust its daily dose from the results of the blood work INR. It is initiated in lower doses in the geriatric or disabled patients or in Asian patients. And for children, initial dosing is 0.2 milligrams per kilogram with a maximum dose of 10 milligrams for 2 to 4 days, and then it's adjusted daily by INR again. The generic availability of warfarin comes in tablets of 1, 2, 2.5, 3, 4, 5, 6, 7.5, and 10 milligrams. Indications for use are 1, prophylaxis and treatment of venous thrombosis, pulmonary embolism, and atrial fibrillation. 2, management of myocardial infarction by decreasing the risk of death, decreasing the risk of subsequent myocardial infarction, and decreasing the risk of thrombolytic events. And 3, prevention of thrombus formation and embolization after prosthetic valve replacements. Warfarin is contraindicated in patients with uncontrolled bleeding, cerebral or dissecting aneurysm, any open wounds, active ulcer disease, and depends on the mental state or condition affecting patient cooperation. If any recent brain, eye, or spinal cord injury or surgery, malnutrition and emaciation, severe liver or kidney disease, pericardial infusions or pericarditis, uncontrolled hypertension, diverticulitis, and also in pregnancy, as it does cross the placenta and may cause fetal hemorrhage. Warfarin is to be used cautiously with patients with malignancy, patients with history of ulcer liver disease or acute kidney injuries, and of course Asian descent patients or those who carry those certain alleles or genotypes. Geriatric population due to greater expected anticoagulant response. Women of reproductive potential and the pediatric population, but more frequent PT and INR assessments are required for that. Warfarin indications are multitudinous. Drug-drug interactions are many, and I will list most of the main ones, starting with clopidogrel, disulfiram, fluconazole, fluoroquinolines, itraconazole, metronidazole, thrombolytics, any NSAIDs, valproates, and aspirin. And all these may increase the response to warfarin and increase the risk of bleeding. Chronic use of acetaminophen may increase risk of bleeding as well. Chronic alcohol ingestion may decrease action of warfarin. If chronic alcohol abuse results in significant liver damage, the action of warfarin may be increased due to the decreased production of clotting factors. Acute alcohol ingestion may increase action of warfarin. And barbiturates, carbamazine, rifampin, and hormonal contraceptives containing estrogen may decrease the anticoagulant response to warfarin. And many other drugs affect the activity of warfarin. Warfarin does react with many natural medications, such as St. John's wort, and that decreases the effect of warfarin. There is increased bleeding risk if used with chamomile, clove, dong quai, fenugreek, feverfew garlic, ginger, ginkgo, panax ginseng, licorice, and many others. And now I'm just going to review nursing considerations with warfarin. Thorough assessment, physical assessment before beginning therapy is necessary to establish baseline status. It determines effectivity of therapy, and it evaluates potential adverse effects. It obtains baseline status for complete blood count, fecal occult blood count, and fecal blood test, and clotting studies to determine any potential adverse effects. To determine PT INR prior to initiation of therapy, and then daily until maintenance dosage is established. We need to obtain complete medication history prior to the start of therapy, as many medications interact with warfarin. Dose is adjusted according to PT or INR. Patients are at greatest risk of bleeding are those whose PT and INRs is difficult to regulate, who have an aortic prosthesis, and who are receiving long-term therapy, and older adult and debilitated patients. You have to assess for signs signifying blood loss, for example, petechia, bruising, dark-colored stools, etc., to determine effectiveness and promote prompt intervention for bleeding episodes. You need to establish safety precautions, example, raise the side rails, adequate room lighting to protect patients from injury. You need to monitor the patient response to therapy. You need to monitor for adverse effects, and to evaluate patient understanding of and after teaching, and monitor patient compliance to therapy.
Going home today.
I know, I hope
Yeah.
so too.
Hi, Betty. How are you? And I'm Darlene. I'm your RN for today.
Hi,
And-
I'm Jonette. I'm her daughter.
Okay, nice to meet you. I heard you guys had some questions about the warfarin. I brought you a pamphlet.
Yeah.
So just in case, when you get home and you still have some questions, you'll be able to have that information as well. So what I can do is we can go over any questions that you have, and I'll answer to the best of my ability. All right.
Yeah, thank you.
I have a question, like if sometime I miss my dose, so what can happen?
If you miss your dose of warfarin and realize it before it's time to take your next dose, you just go ahead and take it. If it is already time for the next day's dose, just don't double up on the medication.
Okay.
Just take that day's dose and not worry about the previous day and just continue on.
And like most of the time I do have my headaches and the stuff, and I take some medication for that. Is that okay?
It depends. You are able to take Tylenol or acetaminophen. That is okay. But what you don't want to do is take any NSAIDs or non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen, or anything that has aspirin in it. Yeah, because it will just make your risk of bleeding higher.
Okay. So do I have to make any other dietary changes for that?
Well, for one, vitamin K is a really big thing with warfarin, and it is found in all your foods and in your body. Vitamin K is found in a large amount of green leafy vegetables, such as spinach, broccoli, and Brussels sprouts. You don't have to change what you eat, but you just don't want to all of a sudden start eating these kinds of foods with vitamin K in large amounts all of a sudden. You won't have to make any dietary changes right now.
So she can still eat it, like just in moderation.
Yeah, in moderation. Yeah.
Oh yeah, I booked my mom for a dental appointment next week.
Okay.
Will the medication affect anything for her dental surgery?
Just for regular dental visits for cleaning and routine care, fillings, caps, crowns, that sort of thing, you're okay. You can continue with your warfarin. But if you are scheduled for an extraction or any kind of surgery, your warfarin may need to be stopped ahead of time.
Okay.
So what you'll have to do is whoever is prescribing your warfarin, whether it's your family doctor, whoever is going to be following you, to go over it with them, what kind of surgery you're having, and then he'll make the decision whether or not to take the warfarin. And always make sure to tell your dentist that you're on warfarin.
Okay.
Yeah.
Okay.
But there is one other thing we need to go over, is the side effects of these medications. Warfarin does come with side effects. And I'm just going to, whether your doctor's already gone through them with you or not, I'm just going to go over them again with you. Some of these side effects can be bothersome, but some will go away with time. Others may persist, and there's other medications that can be ordered or whatever to help you with those. So a lot of people tend to complain or have issues with diarrhea, a general feeling of being unwell, nausea, stomach cramps or pain, and vomiting. Those usually will subside once you've been on warfarin for long enough. And these following side effects could lead to serious problems if you don't notify your doctor. If you start having any headaches, any dizziness, numbness or tingling of your hands and feet or even in your face, any pain, swelling or discomfort, any paralysis, signs of anemia, which is low red blood cells, which can be, again, dizziness. If you notice you're pale, your skin isn't as red and as colorful as usual, any unusual tiredness, weakness, or even if you get short of breath. Signs that bleeding, if you notice you have any pink or brown urine, any cuts that you have that don't really stop bleeding the way you think it should. Nosebleeds. Nosebleeds is a big one. I don't know if you ever get nosebleeds, but if you have a nosebleed that just won't stop, it's important to see your doctor as well. If you notice any yellowing in your eyes, or even your bowel movements, if you notice any light-colored bowel movements. Any unexplained bruising, if you notice bruises anywhere, and any unusual weakness, if all of a sudden you feel really weak and tired. And these following symptoms, if you stop your warfarin and go to your doctor. If you experience any kind of allergic reaction, all of a sudden you have an allergic reaction to warfarin, which, you know, you could feel your throat closing off. If you develop any hives, any difficulty breathing. Yeah, so
You have to monitor that, Mom.
yeah, and there might be other symptoms that you might have that's not listed here. Anything that's different, you should always check that out with your doctor.
Okay.
Yeah. Yeah.
I just want to confirm, like the doctor here came in today and he told me like my next sample for the blood for this warfarin will be due next month when I come for a visit. So I don't need to do it like every day or every week.
Yeah, because in here in the hospital,
Yeah.
they're doing it like almost every day.
Yeah.
Yeah, and that's just to kind of, because they kind of play around with the dose of your warfarin
Mhm.
to get it to, they have a therapeutic number that they go by, and once you're in this window,
Mm-hmm.
then your blood work doesn't need to be done as much, because the dose
Mhm.
that you take
Mm-hmm.
are taking is giving them that number that they're looking for. So right now you're good, you're in this window. So right now, because you're just being discharged from the hospital, the doctor hasn't written the orders yet, but it might be every week for a couple weeks. And then usually it goes to once a month. Once they know that the dose you're on is making your blood where they want it to be,
Mm-hmm.
then it will just be done once a month.
Okay.
Okay.
Yeah.
That was helpful.
Yeah.
Thank you.
Oh, you're welcome.
Yeah.
So I'm just gonna leave. Is there anything I
Mhm.
can get for you right now, or any other questions?
I think
We're
we're okay.
good.
Yeah.
Okay.
Yeah.
All right. Well, you
Thank
have
you.
a good rest of your morning, and we'll see you
Okay.
after.
Thank you
Okay,
so
okay.
much.
See you.
Thank you.
Okay.